Well, good morning, everybody. Welcome to HR Prime's COVID-19, the second wave webinar. Thank you very much for taking the time this morning to join us. We're going to be talking specifically about health and safety guidance this morning. Oh, we're having technical difficulties here. Not sure why it's not moving forward. There we go. Okay. So again, welcome. Sorry about the technical issue there. It's 11:01, so we're going to get started. Today's webinar is going to be co-facilitated by Dan Seuss, a senior health and safety consultant with HR Primed, who has over 30 years experience in health and safety in all types of industries. As well as myself, Chris Goodall. I'm also a senior health and safety consultant with HR Primed with just over 20 years experience in the world of health and safety. The legal disclaimer here is the content discussed in this webinar does not constitute legal advice. However, it should be noted that information is based on best practices and guidance from key authorities, which we'll get into, for example, the regional local health units, as well as the Ministry of Labor and the Ministry of Health. Dan and I have been living and breathing COVID like many of you, but from the perspective of workplace health and safety. So we're going to provide you with some lessons learned. And as a thank you for joining us this morning, we will be providing you with a free COVID-19 policy bundle. That information will be emailed out to you. If you have any questions about it, please feel free to let us know. So please feel free to submit your questions for the live Q&A at the end of the session. We'll do our best to answer the ones that come in. Today's outline, though, is we're gonna start by talking about the second wave and what is it. Kind of timely because we're starting to hear that word an awful lot these days. We'll also get into the big picture, what we can all do outside the workplace, but this also includes what we should be doing inside the workplace. Thing to remember is that COVID is not just a global issue, it's a community issue as well as a workplace issue. And we have things to do in each of those areas. We'll get into a little bit about health and safety basics as well as the hierarchy of controls when we're talking about COVID-19. And we'll finish up with a workplace focus. So hopefully that'll give you some insight and some things to consider and think about with respect to your workplace. Very strange not seeing people, so this is a bit of a new one for me. Okay, the second wave, what is it? So if we think early on, which wasn't that long ago when COVID-19 started or the beginning of it, it was new to the community, new to the workplace. We were starting to see numbers increase. And then once the medical officer of health got involved, Public Health Ontario and our local regional health units, they put in some controls and restrictions. And at that point, we started to see the numbers go down. But we should also keep in mind that the number of testing and what we were learning about COVID has changed drastically, which has led us now to what is being termed the second wave. So the second waves are a phenomenon of disease outbreaks where the number of people infected by the virus may appear to decrease and then increase later on in the same population or a different one. The reality is there could be a number of waves and we don't really know when the waves will end. Historically, we've seen pandemics go through this process. More recently with H1N1, the second or subsequent waves may have the ability to be more serious than the first. So keeping in mind where we've been and where we're going. Being vigilant and taking appropriate measures in preparation of what may happen after the initial wave has a tremendous value in dealing with the pandemic in a responsible and effective manner. So hard to say as to what the second wave is going to look like or how many waves we're going to have as we move forward. Sorry about that, just seeing questions popping in and we'll get to them as we go through here. Ultimately, the objective is reducing harm to the lowest possible level and keeping up the efforts to maintain the appropriate actions to prevent further spread. Until the virus is completely eliminated, the threat for repeated waves is obviously inevitable, which leads us into the big picture. So, what we can all do outside the workplace. But we also need to think about what carries into the workplace as well. So, first and foremost, you need to stay current with the advice and guidance. And I apologize, seem to be having technical difficulties here yet again. Okay, so staying current with COVID advice and guidance. So you need to keep listening to the provincial government. I mean, not necessarily just the news, but the provincial government, as they are the folks that are making the decisions and putting in the legislative requirements that we need to be focusing on. The other thing that you should do is look to your local regional public health. So for example, where I am, I'm looking to Southwestern Public Health for guidance. If I was in the London area, I would be looking at the London Middlesex Health Unit, as well as the Region Appeal, you'd be looking at theirs. So it's important to make sure that you're staying consistent with what your local needs are, and the best way to do that is to be following your local health units, because they are going to provide you the best guidance. So for instance, screening questions of symptoms have changed a few times since the beginning of the pandemic, and again, your local health unit is staying on top of that. Don't become complacent about hand hygiene. I know we're getting tired of hearing it, but the fact remains touching surfaces than your face may expose you to the virus, and hand washing or using hand sanitizer is key to reducing the spread of the virus. Next up is physical distancing. Do not get complacent again about physical distancing. While it's important to stay connected as well as support local businesses, and it has been a struggle to keep up distancing practices for the past few months, it's also important to continue to make smart choices to limit person-to-person contact, which is the way the virus is spreading. So limiting the number of people in your social circle plays a vital role, and distancing oneself from others is a must. So again, challenging times. We've got going back to school had an impact on physical distancing. We've got holidays coming up that has an impact on physical distancing. And recognizing that, I think we all had a bit of a sigh of relief come the end of the summer when numbers were getting quite low. Now all of a sudden the numbers are heading back up there, so we need to make sure we're diligent. Limiting gatherings. So again, in the same vein here, we want to make sure that we are limiting those gatherings where possible. Face coverings and masks. Again, much has been discussed about that over the last little while, but wearing a face mask or covering when you're unable to maintain physical distancing of 2 meters, even for short durations, is important. This also applies to being outdoors or anytime you're unable to maintain physical distancing, obviously from the folks that are not in your social circle or bubble, if you will. Use a face mask if you go into the public enclosed spaces as per the local health units. And things like taking public transportation, another important place to be wearing your masks themselves. So again, that is what is consistently being recognized as source control, and something that we should be doing where at all possible. Next up, we're going to talk a little bit about the health and safety basics. So from a health and safety perspective in the workplace, this is the primary method of looking at hazards in the workplace and how we should be controlling them. So just from a prevention is the key to reducing exposure and harm. We need to be proactive, which is going to take effort, ingenuity, flexibility, and an ongoing commitment when we think about these things. Even though it may sound daunting, it's been proven over time and time again that the hierarchy of controls is the best way to deal with hazards, whether it be in the workplace or in the community. So as we go through the hierarchy, obviously the number one thing to do is eliminate it, physically remove the hazard. So when we're thinking about physically removing the hazard itself, we can't get rid of the virus necessarily by ourselves. We all play a role in that. But it is the most effective way to deal with the hazard. So eliminate or reduce the amount of people in the area, not allowing people who do not pass the screening into the workplace. So again, you got to think about how are we going to provide those services to people, as well as working remotely. So those are examples where we physically remove the hazard or the person from the hazard in the workplace. When it comes to substitution, it's going to be very difficult to replace the hazard. Next up is the engineering controls. really isolating people from the hazard where possible. So again, this is going to depend on the type of work environment that you're in. So physical barriers in place of physical distancing or service counters, restrict and control access to areas, limiting the numbers to ensure physical distancing is in place, using equipment to eliminate the need for workers to work in close contact. So we're seeing out there more and more people driving by themselves in work vehicles. We're seeing people using 2 lifts instead of 1. Dedicated or extra exits and entrances, planned walkways. So again, you're engineering the control in the workplace. Redesigning or modifying the workplace or tasks to allow for physical distancing or less interaction, again, is another form of engineering controls. I don't know that anybody thought in March whether we'd be still dealing with this in October or not, but now, looking at public health, I'm not sure there is an end in sight at this point in time. So we need to be making these changes for the foreseeable future. Next in the hierarchy of controls is the administrative controls. Administrative controls typically contain policies, procedures, education, scheduling, and signage. What we're trying to do here is change the way people work. So clear information and procedures on screening. So there's a difference between active screening and passive screening. So you see a poster on the wall, it says if you're not feeling well, you should go home and come back later. Active screening is physically asking people those questions and making sure that they've passed before they go into the workplace. Policies and education on physical distancing, what does it look like? What does the 2 meters look like? How do you accomplish that in some of your work areas? Cleaning and disinfecting surfaces. So how often and with what? And what should we be cleaning? Everything from those high touch surfaces to, fabric on chairs. What can you do when it comes to that? What are you going to do if someone's being tested? So again, what happens if someone is confirmed versus being tested in the workplace? What should we do in those situations? It should be crystal clear to everybody. Another opportunity is scheduling. So things like staggering break times or start times for work to try and reduce some of that congestion or bottlenecking when it comes to arriving at work and lunches and breaks. Coordinating with other workers and departments to ensure rooms aren't exceeding those capacity numbers that we're talking about. Signage. So again, a couple of things with signage we have to be careful with. It provides good information, provides expectations, but we're running into signage pollution out there. So again, we don't want people not to be looking at the signs. So we want to make sure things are being very clearly signed and that people are able to point to them for ongoing guidance. So a key aspect is the ongoing evaluation, instruction, and supervision, which is going to include coaching. Right? As things are changing, we need to make sure that people are changing as well as they're being informed of these key changes. And last but not least in the hierarchy of controls is personal protective equipment. That seems to be what everybody is jumping to. I mean, it's certainly something that the Ministry of Health as well as our public health units are really striving for. So keep in mind, it is the last form of defense. And it's important to provide clear information and instruction on use, care, proper putting on and taking off, as well as limitations of that personal protective equipment. It sits in your vehicle. Again, where are you putting it? How often do you need to replace a medical mask or your face covering? How often should you be washing it? So all of this information needs to be provided to employees. Again, the difference between a face covering, medical mask, or respiratory protection in general. Eye protection, so what are we talking about there with whether it be glasses, goggles, or face shields? Again, something to consider is if you're wearing safety glasses or goggles or a face shield, is it fogging up? What are we going to do about that, and how should we be providing information to our workers and to our communities? So it's valuable to note that the preceding points, although I went through them fairly quickly, in that a commonly used and talked about approach has been frequent hand washing, social distancing, and use of face masks. These are among the most important and effective in working to move controls from one level to at least the next highest level. So again, from a due diligence perspective, when we're talking about the Ministry of Labor, they're going to look at, are we following the public health recommendations and guidelines? Are we doing the screening? Are we enforcing the physical distancing? Are we enforcing hand washing? Do we have the hand washing set up in appropriate spots? And again, that's what they're going to be looking for. They're also going to be looking for this. Did you use the hierarchy of controls? Did you try and remove the hazard? And then moving your way down. You certainly don't want to start at PPE and move your way up. So I went through that pretty quickly, hoping to have time for some questions near the end, and I will pass it over to Dan.
Well, good morning and well done so far, Chris. Great points covered to this point. Let's take a look now at the workplace focus. Let's see what is it within the workplace that we can do and how can we proceed. With the background set, with all of those points that Chris has covered, this inside part of the workplace is just as important and just as valuable as what we do outside the workplace. So the conditions that can take us into and beyond the second wave. Similar to conducting a risk assessment for planning to reopen following the first wave of COVID-19 cases, your organization should undertake the conducting of a risk assessment, just like was covered already by Chris, in preparation for a recurrence of the cases in this second wave. And as you probably have already heard, even the Premier of Ontario has indicated we are in the second wave. While the intricacies of risk assessment will vary among the different business types, the following steps are commonplace. First, let's identify the hazards that we have available that are within our workplace relative to COVID. Be critical about what your workplace exposures may be. Among other factors, what happens if an infected person enters your workplace? What do? How do you deal with that? Conduct a walkthrough on the worksite and consider your high-risk areas. Consider what tasks employees are performing and whether or not they are specifically exposed to COVID-19 risks when performing their duties, such as those people within your workplace which may be customer-facing employees within the workplace, people who meet others that are from outside the workplace, shipping and receiving activities, for example, people that are in those areas, they're meeting people that are from outside the workplace. Ensure that your walkthrough that you actually do includes conversations with staff. Just don't do it blindly. Get engaged with them. Who may be harmed by a second wave of cases and how? Well, once identified, the hazards noted determine what populations of your workforce are exposed to COVID-19 risks. Through this risk evaluation, you may need to take note of the high-risk individuals. For example, staff members who meet with visitors, customers, or individuals with pre-existing or compromising medical conditions, among other things. So those are part of your considerations. Next is assessing the risks. Now, analyze the risks to determine potential consequences or those outcomes or results. And for each of those risks that your business is facing, determine how likely is the particular risk to be present. And secondly, what are the ramifications should the risk be present? Consider potential employee safety compliance requirements. Also the financial impacts, of course, business disruptions, reputational damage to your business, and other undesirable or unwanted and impactful consequences. When addressing the controls associated with the risks, consider ways to address the threats. These are a variety of methods that businesses can use to manage the risks, including the following. First of all, risk avoidance. When a business eliminates certain hazards, especially with respect to COVID, activities and exposures from its operations altogether, if you can do that, then you are avoiding the risks. If you can't avoid the risks, for those, you now take a look at risk controls, just as mentioned. And those involve preventive actions and follow the hierarchy of controls. The other option is taking a look at risk transfer. When a business transfers its exposures to a third party, such as suppliers, contractors, and personnel agencies, that means you're passing along their obligations to manage risk to the level that you expect so that the minimum exposure of the hazards are associated with what you face in the workplace. For preparing a second wave, control measures should include cleaning protocols, staggered starts and stops, access control strategies, that is, who comes in when and where and what doors. Potentially, you might arrange people coming into your workplace, such as your workers, coming in through one door and then exiting through a different door when they leave at the end of the day. therefore separating those incoming and outgoing personnel. Work from home arrangements and mandated personal protective equipment requirements. A lot of workplaces already have arranged people who can work from home and still conduct the needs of the business. For those people who need to be within the workplace and physical distancing is not possible, definitely masks are a must. And again, following your health unit's protocols. Next is monitoring the results. Risk management is an evolving and continuous process. Monitoring implemented controls for their effectiveness is critical. So whatever you said you would put in place, now take a look. Is it actually happening? Expect to make some course corrections based on the monitoring results. Maybe you're not finding exactly what you thought would be happening, so you may have to make some adjustments. Cycling through the preceding processes is a must in order to ensure being thorough. Remember, the COVID-19 pandemic continues to be rapidly evolving and direction can change quickly. Be nimble. Your business should be prepared to take action on short notice. Be alert, be nimble, and be effective. Another aspect is workplace safety in terms of its maintenance. I believe we're on the next slide. As has always been the case, ensuring that policies, protocols, practices, controls are in place, in effect, and maintained demonstrates the diligence in your approach to managing for health and safety. Some basic examples are provided here. Note that these are by no means inclusive, and there are a number of highly reliable, trusted, and respected resources providing more exhaustive lists. Consider engineering controls that we talked about earlier. Those are things like employing high efficiency air filters in enclosed spaces, increasing ventilation rates in the general work environment, and allows for outside air to come in as well, fresh air, where it's possible, and installing physical barriers such as clear plastic guards or shields between workers who have to be within a close distance and between workstations or desks. Implementing administrative controls, typically those kinds of things are establishing alternating days, extra shifts, reducing the total number of people at any particular given time, staggered starts and stops, as was mentioned earlier, screening employees, visitors, and contractors before they enter the workplace. Ensuring that protocols are not in violation of any human rights is a consideration as well, of course. Communicate screening protocols that affect all parties ahead of its commencement, so make sure that they're aware of what you'll be doing and how you'll be doing it. And consider conducting screening procedures to identify potentially ill employees before they enter the workplace. Screening should be implemented on a non-discriminatory basis, and all information gathered should be treated as confidential. Again, when we come to the actual use of PPE, where and if that is required, training the workers on the proper PPE best practices and understanding how to properly put on, take off, and take care of the PPE. How many of you, where masks are required, actually make sure that people wash their masks or replace their masks on a frequent basis? Training materials should be easy to understand and must be available in the appropriate language for all workers where training in the use of PPE or any policies and procedures are important. Communication and engagement, among many other tools, will help make and improve workplace health and safety measures. Communication is a key factor. Far overlooked aspect of communication is the two-way aspect. A message that has not been delivered, if it has not been received, is not a useful piece of information. Here too, creativity is expected to be deployed to ensure the message that was intended has actually been delivered and followed. Creative means to make this happen helps everyone to ensure that we're on the same page, as is indeed the reality. Additional communication tips: be open with employees about management decisions and ask for suggestions to address and remedy problems. Provide as much information as possible about the pandemic. Communicate the future of the business with employees often. What are you doing in your business and how are things going? Use company intranet sites where that's possible, newsletters, blogs, whatever means of communication you think are important and valuable and effective in your organization. Be empathetic in your communication, as every employee's situation may differ. Additionally, try to give as much notice as possible if your organization plans to make significant changes that affect some or all employees. Preparation is key. Preparing a plan and planning to prepare go hand in hand. The expression failing to plan, well, you know the rest. Your workplace, its employees, customers, suppliers, and others are reliant on your overall success. Keep on top of things and engage to stay informed through your local health and safety authorities and information providers and other proven trusted resources, as Chris had also mentioned. Final points. As a takeaway, the following points are presented. And these points are borrowed from a well-respected health and safety resource, Stephen Shaw from WSPS. He's the Director of Integrated Operations. Number one, review your response to COVID-19 so far. Where are you and where are you going? Number two, if you haven't conducted a thorough COVID-19 hazard assessment, do it now. Number three, indicate new COVID-19 policies and procedures into your established policies. Next, drop contingency plans for a possible return to a lower stage of opening. That may be necessary based on what the government says is required and also what you find based on your workplace. Next, keep your emergency contact list up to date. You may have found that there's some gaps based on how you went into stage one. Well, you may have to go through this again in terms of taking a look at that, so make sure your contact list is current. Number six, record contact information for all visitors for contact tracing purposes. Make sure you know who's coming and who's going. If you have staff which are coming and going and not punching in, as it were, and having a record that way, maybe getting a sign-in log and a sign-out log will help to keep control and manage who's been in your workplace. Number seven, continue monitoring COVID-19 in your area, not being in your region and in your physical location. Find out what's happening and keep abreast. Number eight, ensure you have enough PPE. As many of you probably experienced in the first wave, PPE was difficult to come by. So plan and prepare now. Make sure your stocks are adequate and appropriate. We may see in a second wave that shortages may arise again. Number nine, keep employees engaged in minimizing COVID-19 hazards. Be informative, be informed with them, and communicate with them on a regular basis. And again, keep the two-way streets open on that communication. Number 10, up your efforts to minimize employee stress and anxiety. We're all facing a time that's different, that we're not expecting, and now after many months of this, many people are starting to become tired and leery and maybe losing focus related to what's required to be done. So we in the workplace have to make sure that we keep things fresh and alive and people stay alert and in touch with what's needed in the workplace as well. Number 11, consider your options for continuing or restarting health and safety training. There may be opportunities to do training that you need or training that's been held back for now a while, and now may be a time that you're able to get that back on track. Number 12, promote the flu vaccinations to keep employees healthy. As many of you have heard, flu symptoms and COVID-19 symptoms, unfortunately, are very similar. So at the very least, if we can help prevent people from getting the flu, then we may be more assured of people being able to respond appropriately when they come down with symptoms, which in fact may be either the flu or COVID-19, but in any event, if they are helped to prepare to prevent the flu, then at least you're giving them the tools equipped to make sure that they know what they may be facing when they're not feeling well. Final words. Doing the right things for the right reasons and doing it together with your organization. That's leadership. And with that, we'd like to turn over to a shout out. Big thank you to Wages Corp, which has been a tremendously powerful and ongoing sponsor. They're involved with hiring and retaining and administrating within workplaces. So big shout out to them and a promotion to them in terms of their support for what we do. Q&A. I'll turn the floor over back to Chris to maybe go through any questions that have arisen since we started the session, and maybe we can together address those. Chris, over to you.
Awesome. Awesome. Thanks, Dan. So we are open for some questions here, and we'll be on for a few minutes if you have any. It looks like we've got a couple that have come in. Dan, maybe you can take this one here. How does the Ministry of Labor consider due diligence with respect to what employers and supervisors do or don't do to protect people in the workplace?
Well, yeah, that's a great question. As you may have picked up, there were a number of points raised through the presentation. And by the way, the presentation will also be available sometime in the next day or two for anybody to revisit and to share with others if you wish. The term diligence has appeared in a number of points in our presentation. What the Ministry of Labor is looking for, Ministry of Labor now Training and Skills Development, is looking for, is the workplace doing everything reasonable under the circumstances to protect the workers? And the first point of reasonableness the ministry will be looking at is, are you following the guidelines as provided by your local health authorities? Are you aware of what those guidelines are in the first place? And then what have you done to make sure that they're in place? As was also mentioned in the presentation, planning. Those last 12 points, if you're able to follow those and deal with those, then you also are able to demonstrate your due diligence. And in doing so, basically taking every precaution reasonable to protect your workers and anybody who enters your workplace to make sure that you've got all the right things in place to help prevent, to the best possible level, the spread of COVID-19 virus. So that's sort of an example of what you're doing. If you have any questions in what you do for due diligence and you're not certain that what you have in place is working or is appropriate for due diligence, by all means, reach out to HR Primed. We're more than happy to help you through that.
Awesome. Thanks, Dan. So we have another question that came in. A worker we saw at work yesterday calls in to say they've been tested and show positive on their COVID test. What do we do at the workplace? So I'll take a stab at that, and then Dan, if you have some further thoughts on it. So essentially, what my understanding is once the health unit is made aware of the positive test, that individual would be contacted. So the person with the positive test would be contacted, and they would be looking for information, essentially in the last 48 hours, who have you had close contacts with? And essentially the health unit takes on that contact tracing role and would be contacting workplaces if they felt it was necessary from a public health perspective. I don't know if you have any other thoughts on that, Dan.
Yeah, that's perfect. It goes in line with also what was covered in the presentation is if the workplace then is contacted by the local health unit, which is now trying to connect the dots as to where a particular individual may have been and who may have been around them, comes back to, again, what have you got in your workplace that can help to share that information? So for example, that log that I mentioned, people logging in and logging out, and you having knowledge of that, you can then share that with the Ministry of Health or your local health unit, as it were, to say, yep, this person was in this workplace between this time and this time over that particular period of day or days that they may be questioning. And here are the other people that were present at the same time. So now the Ministry of Health or that health unit has that information that they can follow up with those individuals to make sure that they're properly notified and, if required, tested, etc. So that's a great connection to the presentation and that kind of a situation that may arise. The other thing that you may use as a resource for this, by the way, too, is the health unit. When they contact you and say, we've got this worker who's proven to be tested positive, they may be asking you a number of questions. And if you have other questions or are stumped a little bit in terms of what to do next, then ask them for what do they recommend or suggest. And they too, in turn, will help you and make sure that you got all the right information.
Awesome. Thanks, Dan. So I'm not seeing any more questions out there, but I would just like to reiterate what Dan said. If you do have questions or concerns, whether it's health and safety related or HR related, and it has anything to do with COVID, please feel free to reach out to HR Primed. We have a wealth of knowledge and experience on the team, so I'll walk you through that here. If I can make sure this is going to work. So just a snapshot of the team here at HR Prime. So we've got Morris, Steve, myself, and Dan, Neil, Benjamin, Taylor, and our fearless leader, Darcy. We also have our technical support side of things, as well as HR Prime's mascot, Tar Heel, and technical support is Mike. So, seeing no further questions, Dan and I would like to thank everybody for taking the time to hear what we had to say today. I hope you found some value in the knowledge that we've provided. Please feel free to reach out and stay safe. Take care. Bye bye.